All right, so we talked about general considerations with neuromuscular electrical stim, including contraindications and precautions, which you should be well aware of, and indications. So the 6 indications that we talked about were in 2 groups, really. One group being this lecture, muscle strengthening and endurance, and the other group being functional. So we'll talk about that in the last lecture for this chapter. So the learning objectives for this part are to describe the elements of implementing a treatment with NMES, waveform options, stimulus settings, and what we need to do to achieve an adequate dose of stimulus. I want you to be able to describe how frequency, duration, on-off time, ramp time, overall affect motor response with electrical stim, and what happens when we change those different settings. So, and we'll experiment with that in the lab. So which parameter would you change out of those listed if a stimulated muscle were twitching and you wanted to elicit tetany? We'll talk about that. And I want you to be able to explain the separate indications for muscle strengthening with NMES. So overall, those first 5 indications that we talked about in the last section were for muscle strengthening. And the last one was for functional. So these are the 5 indications for strengthening for neuromuscular electrical stim. So just to increase muscle strength. To enhance performance in healthy muscle. This is rarely done in a PT setting, probably more in an athletic training or research type setting. To improve muscle endurance, to facilitate range of motion, or to modify spasticity. So to improve muscle force, using e-stim to improve muscle force, the purpose of using the e-stim is to facilitate motor recruitment in muscle that's inhibited by pain or other non-neurological factors. So sometimes, this is a lot of times where we're using this is post-surgically. After any kind of knee surgery, most people's quadriceps are usually inhibited, and we're trying to disinhibit them, basically. We're trying to facilitate motor recruitment. It might be because of pain, it might be because of swelling, so non-neurological factors. Also to augment motor unit recruitment and muscle force. So you've got this wimpy little quadriceps contraction and we want to augment motor recruitment to increase muscle force. Or to retrain inhibited muscles to fire. So we've got this inhibited muscle group in the quadriceps after surgery, and we're trying to retrain them so then we can transition into functional movements. So the goal of PT is always going to be to improve function, but we might be using this as a stepping stone to that goal. Most of the e-stim studies that are quoted in the references that I have attached to this section are done with quadriceps muscles following knee surgeries. And that you're going to see a lot of times that's what you see in the clinic. Quadriceps muscles following knee surgery, tibialis anterior following knee or ankle or hip surgery if you have a drop foot sometimes because of things that happen during the surgery. Of course, that's a neurological factor generally, and we'll talk about that more in the next section. Sometimes for upper extremity, you're using, you're stimming the wrist extensors because you want to facilitate motor recruitment or augment motor unit recruitment in the wrist extensors for functional movement of the hand. So we're back to the strength duration curve. Imagine that. The current amplitude needs to be a contraction that is 10 to 50% of the maximum voluntary isometric contraction of the uninjured limb. So we're not going to, the maximum voluntary isometric contraction of the injured limb is going to be different because we're not getting optimum muscle recruitment. So we want to get the injured limb back up to the uninjured limb. So we want to have at least 10% of what we have in the uninjured limb. The pulse duration is going to be in that mid-range, that 150 to 350 microseconds. At least we want to get 200 microseconds to recruit A alpha motor neurons and reduce recruitment of pain axons. So greater than 400 microseconds might be needed for large muscle groups. So we are going to experiment with this in the lab as well. We're going to change our parameters and see at which point are we getting the muscle contraction that we desire. So look at your strength duration curve. That is going to tell you what parameters you need to set for amplitude and pulse duration, because amplitude's on the y-axis, pulse duration's on the x-axis, tells us which nerves we are recruiting. Is it possible to recruit sensory motor and sharp pain nerves all at the same time? Heck yeah, it is. Check out your axes and see where you have something that brings in all three of those. So we want to recruit a lot of times sensory motor, but we do not want to recruit those A delta sharp pain fibers. So we're really looking at, so if you have those higher pulse durations, you might have to have a lower amplitude. Okay? Frequency is generally 20 to 30 pulses per second for small muscles, 35 to 50 for larger muscles. A lot of our muscle stim applications were in that 35 to 50 range. 50 to 80 may not only increase muscle strengthening, but also increase fatigue. So the 35 to 50 pulses per second is the sweet spot for larger muscles. If we're going smaller muscles, we're going a little bit lower on the frequency, because it's not going to take as much frequency to get to tetany in a smaller muscle with fewer motor units. Okay, and so if you are getting muscle twitching but not tetany, that is a sign that you need to turn up your frequency. Let's just say, for funsies, that we are stimming our wrist extensors, so we're using 20 to 30 pulses per second because those are relatively small muscles. And you have your frequency set at 25 because you decided you wanted to split the difference between 20 and 30. And you're getting some nice twitching in those wrist extensors, but you're not getting tetany, which is what we're trying to get. You need to turn up your frequency. So that's the answer to that one study question is, what do you need to do if what parameter do you need to change if you're getting twitching and you want tetany? You need to increase your frequency. The duty cycle is you have a work part of the cycle and a rest part of the cycle, and the idea of using this on-off scheme is to minimize fatigue. So there are times, like when we're doing, when we're trying to reduce muscle spasm, that we're trying to induce muscle fatigue. So we might go to a different duty cycle ratio. Normally, 1 to 3 ratio or 1 to 5 ratio can minimize fatigue. So that's 1 second on, 3 seconds off, or 1 second on, 5 seconds off. Okay, you do the math. If you're doing 1 second on, 5 seconds off, how many muscle contractions are you going to get in a given time period? Okay, so a lot of times in a treatment session, you're not going for a certain time period, you're going for a certain number of muscle contractions. And then you have to do the math to figure it out on the duty cycle. As the muscle endurance improves, you might reduce the ratio to 1 to 2 or 1 to 1. Or if you're deliberately trying to fatigue the muscle, you might do a 1 to 1. 10 seconds on, 50 seconds off is a good place to start. So if you're doing 10 seconds on, 50 seconds off, in 20 minutes you're going to have 20 muscle contractions, because that's a minute for a whole on-off cycle. Okay, and you might need to do that for someone that has low muscle endurance to minimize fatigue. So on special devices or functional electrical stim devices, that they actually can override the duty cycle because you're trying to get the muscle to work in a functional manner. So ramp times are real time experienced by the individual. Remember, the rise time and decay time, that is not within our perception to discern, but ramp times. It's the real time in seconds to reach the peak amplitude or to return to 0. So ramp up is going to be 1 to 5 seconds and ramp down is going to be 1 to 2 seconds. It protects joints from jamming at the end range. So if you had no ramp time and it just went on, you might be jamming your joint. So it also gradually provides stretch during range of motion activities and spasticity control. It allows the patient to get used to the stimulus. So the ramp time is calculated as part of the on time cycle, the ramp up time, and the ramp down time is calculated as part of the off time cycle. This varies with the equipment, so read your manual and know what your equipment does if you're going for a specific goal. So to minimize muscular fatigue, increased rate frequency will enhance motor unit recruitment. So that's why if we're not getting the motor unit recruitment that we want to turn up the frequency. Neuromuscular fatigue is a limiting factor on that, though. So we're skating the line between getting the muscle recruitment that we want and fatiguing the muscle. So the duty cycle has to allow for recovery time. 1 contraction per minute, it's on for 10 seconds, off for 50 seconds. So if you want to do 10 to 20 contractions, 1 contraction per minute, you're going to spend 10 minutes in the treatment cycle. If you want 20 contractions, you're going to spend 20 minutes in the treatment cycle, and then it's probably 5 to 10 minutes for setup and 5 to 10 minutes for breaking down. So you got to work that into your session. With waveform selections, we can do alternating current or pulsed current. Of course, we're not going to do direct current because there's no off time, right? So it's either going to be pulsed or alternating current. The alternating current application that's usually used is Russian current. It has a high peak and a low average, variable burst frequency, and some people consider this the waveform of choice for this application. Your mileage may vary. So some people feel like Russian is too bitey. If you have a person that's really sensitive that you need to use this on, you might want to go with a less bitier application. Biphasic pulses can either be battery, like a TENS unit, and we're going to do it with all these different units in lab, and you're going to see what it feels like. So the battery units, or clinical units like the plug-in to the wall sort of units, also have pulsed current. And the peak and average amplitudes are similar, whether battery or clinical units, and it limits the peak amplitude and limits deeper recruitment. So that's one of the reasons why people like Russian stim, is because it's supposed to have deeper muscle recruitment, but again, your mileage may vary. Bottom line, NMES may be used to enhance muscle force production, particularly when muscle performance is inhibited by pain or other factors, or when the client cannot maximally recruit motor units voluntarily, so post-surgically in a knee patient. That's a really common post-surgical intervention. Waveforms with high peak and low average current with durations of around or less than 200 microseconds are most desirable to recruit large or deep-lying motor axons with minimal discomfort, but may not provide adequate pulse charge. So the pulse duration of 400 microseconds or more may be required to recruit those large muscles. So muscle stim is definitely one where you have to kind of spend a lot of time figuring out what works best for your individual patient with their individual nervous system and muscles. Okay? And hold the strength duration curve close to your heart while you're doing it. So muscle strengthening for orthopedic conditions, really common use, increasing strength after surgery, ACL construction or total knee arthroplasty, or in non-surgical management of other knee conditions like osteoarthritis, rheumatoid arthritis, or patellofemoral syndrome. So remember way back when in kinesiology when we talked about a weak VMO affecting patellofemoral syndrome? So strengthening that VMO with electrical stim might be a good treatment for patellofemoral syndrome. So muscle strengthening for healthy adults and athletes, this is very commonly not done. Very commonly not done. It's kind of like a double negative. Anyway, it's not usually done in a physical therapy setting. It's more often done in a sports performance, athletic training, research type setting. In addition to the addition of neuromuscular electrical stim to strength training can enhance strength gains. It may or may not enhance functional performance, and it probably won't because it's not a substitute for sport-specific training. It can enhance strength gains, but it's not a substitute for sport-specific training. It's not going to make you better at your sport, but it might help make your muscles stronger. So the contractions that you're using when you're doing muscle strengthening in a healthy person or athlete, the contraction is going to be greater than 50% of the maximum voluntary isometric contraction. So you got to go nuts on the E-stim for these people. Because remember, they're athletes, they're healthy. They can do more than someone who's not. Other conditions that the muscle strengthening might be used for is swallowing, dysphagia. Of course, it's usually speech therapists that are doing this. Urinary incontinence and pelvic floor dysfunction, and that's used usually by people who are women's health practitioners. Promoting circulation reduces risk of clot or DVT formation. So there are reasons for using it in healthy adults and athletes, although you might not commonly see it in the clinic. To enhance muscle endurance, and whenever I have a number in brackets, it means it refers to one of the references I have listed in the first PowerPoint for this chapter. For clients who have experienced disuse atrophy secondary to pain, like they've been immobilized after a surgery, their surgical recovery, people who are in a cast boot or something like that, the goal of E-stim to enhance muscle endurance is to recruit smaller fatigue-resistant motor units, those type 1 fibers, at a moderate rate of firing rather than a maximal force recruitment. So a lot of times you're having them do an isometric or an isokinetic contraction along with the electrical stim. So you're enhancing it. Same thing when you're doing it for muscle strengthening in addition to strength training or as an enhancement to strength training, you're having them do a voluntary contraction at the same time they're doing the electrically induced contraction. The waveform that you're going to use to enhance muscle endurance, usually pulsed current, 25 to 75 pulses per second for frequency, modulated burst, so Russian stim, or 50 beats per second for the burst frequency, or 50 bursts per second. So the stimulus settings, the waveform amplitude we want is 50 to 70% of the maximum voluntary isometric contraction. That is way higher than we're doing for strengthening. So we're doing 10 to 50%, and this is above 50%. Okay, pulse duration is high. It's a long pulse duration. Pulse rate is about the same. It was 30 to 50 or pulse rate, for frequency, it's about the same. It's the least frequency required for a smooth tetanic contraction, and that's going to depend on the fusion frequency when all the motor units combine together to form that tetany. The strength of contraction is submaximal with a high repetition rate for endurance. And the number of repetitions will depend on how the muscle fatigues. If you're going at a higher amplitude and a higher pulse rate, you're going to get more fatigue. Signs of fatigue are progressively diminishing contraction with maintained or increased pulse charge, amplitude, quivering muscle at rest, muscle guarding at rest. The patient's going to report an aching feeling in the muscle. Or they come back to the next treatment and they go, man, I was so sore after that last treatment. That's a sign that you had pushed them into muscle fatigue. Bottom line, NMES may assist in improving muscle strength and endurance. in clients whose muscles are weak secondary to disuse atrophy. The application may also be appropriate to conditioned muscles, which may then be stimulated in an ongoing fashion for functional outcomes. This is a picture of the portable NMES unit that we have in the lab. You'll see this in clinical settings a lot. You can do NMES or TENS or some other applications using this same unit, and we'll get a chance to play with those in lab.